Welcome to the Capital Integrative Health Podcast, a podcast dedicated to transforming the consciousness around what it means to be healthy and understanding the root causes of both disease and wellness. I am Dr. Andrew Wong, co-founder of Capital Integrative Health, an integrative practice committed to expanding access to holistic root cause medicine to the global community. Today we are bringing you a special conversation with two of our own amazing medical assistants, Tope and Akhil. Tope and Akhil joined our practice as medical assistants, and both are planning to attend medical school next year. We had a great conversation today about how their experience here at Capital Integrative Health has shaped their vision of healthcare, and how they hope to see integrative health brought to the forefront of medical care in the future. Welcome, Akhil and Tope, to the podcast. Thank you so much for being here.
Thank you. Glad to be here.
So let's start first about some basics. What do you do at our practice, Capital Integrative Health? What brought you to CIH?
Yeah, so I am a medical assistant. I'm actually Dr. Wong's. I'm your medical assistant. So you're like kind of your right-hand man. And I do a decent amount of things, starting with triaging the patient, getting their vitals, starting out, we do an array of different tests such as EKGs, lung spirometries, and recently we started allergy testing a couple months ago, in addition to, just responding to any patient concerns, anything that they need, such as medications, referrals, whatnot. And a big part of our job is being an integrative and functional medicine clinic. We have a bunch of unique different tests. So a lot of my job, too, is patient education on those specialty labs and things that you are not normally getting at your day-to-day doctor's office or your conventional doctor's office.
And I mostly work with the clinical assistant team, so we do a lot of procedures such as our Evoke brain scans, our vital scans to test your nervous system. We also take a look at your stomach acid with the Heidelberg testing, and then we also run the red light.
Great. Well, thank you both so much, and obviously you both do such a great job. We're so happy to have you here. Grateful. What are your long-term goals, and do you have any specialties in mind? We can talk about both of you. Congratulations. You both have gotten into medical school recently.
Thank you so much.
Yeah.
Thank you. Very happy about that.
Oh, yeah, so happy.
So proud of you.
So I guess long-term goal-wise, obviously, like a physician is that's the end goal. But I guess the thing throughout this whole process, it taught me it's not just becoming a physician, it's what kind of physician do you want to become, and that's not just specialty wise, right? Some of the specialties I'm involved in or I want to be or I'm interested in are primary care. That's a huge one. Endocrinology, that's another big one. Gastroenterology is probably my favorite out of all the subspecialties. But in terms of long-term goals in type of physician, a lot like Dr. Wong, I want to be that inclusive physician. I want to be a physician that's able to meet the patient where they're at and, kind of cater your healthcare, your plan to what that patient is going through. And how I'm going to get there, I'm not sure yet. I think I took the first step with medical school, and I have the experience of CIH, so I know that it can be done. So those are some of my goals, yeah.
Well, hopefully we can tape another episode in 4 years from now and have you both back on here. This would be great to kind of have a reunion at that point to see what happens after medical school when you guys decide. What about you, Tope?
For me, I think my thoughts are in a similar vein as Akhil, which is definitely, I do want to be a doctor that definitely, I guess, hears out their patient, works with their patient, and really just forms a solid connection with them. When it comes to my specialty, I'm also looking at endocrinology, and then also dermatology seems pretty cool too. I'm super interested in that. It's been a recent, I guess, interest of mine. Also, maybe, who knows, maybe someday we'll decide to open up a little practice of our own. We'll see what the future holds, though.
That's awesome. Everyone loves skin health. Definitely can't go wrong with that. And certainly 88 to 90% of people have metabolic syndrome and have many issues with blood sugar and being overweight and hypertension and things like that. So those are great potential specialties. What motivated you both to pursue medicine in general?
Yeah, so I feel like I'm writing my personal statement again with this answer. We've had to answer this question a lot, but so it was a couple of different factors for me. Number one, specifically, my cousin, he's autistic, and he was my best friend growing up, and I kind of saw that he wasn't getting the healthcare that he needed, and it was so interesting how to navigate that with him. And I would, observe some of the physicians that would work with him, and I saw that the effect that they were having on my cousin, and also the care that they gave to our family, just the peace of mind with the patient education. And that was my first, I was like, oh, this is something really cool that I kind of want to get into. And then over the years, I studied neuroscience at the University of Michigan. So that's how I kind of got into it from there. And over the years, after graduating, I worked in research in the DC area. I worked as a scribe. I worked all these different types of jobs in the medical field. And then I was like, okay, I think that after all these experiences, I think I want to be in charge of the healthcare plan, and the only way to really do that is if I become a physician. So that's what it brought me to that direction.
Great. Thanks, Akhil.
And then for me, my mom actually has been a nurse pretty much since I was born. So she's been a huge, role model and motivator for me. She's actually an NP now, and I remember like throughout my youth, she was always just like studying books, and I was like right next to her, like at her hip. So that's kind of what got me interested in medicine, just watching her do her thing. And I guess after that, I went to high school and was able to do this like type of early medicine program where you got to train as like a CNA. So we got like actual hospital experience. And then that was kind of my actual like true foray into like medicine. And that's when I really realized like, oh, I can't see myself actually doing a job where I'm not actually connecting with people and like helping manage their healthcare outcomes. So that's really what solidified like this is what I want to do for sure. And then after that, I of course went to undergrad and did some volunteering here and there with different like clinical work. But CIH was, I guess, my real first like actual clinical job. And I really loved the process. It's been amazing. So that's kind of what solidified to me that I definitely want a future in medicine.
When did you become interested in integrative health, integrative medicine?
So I'll say probably sometime within my first week of working here. I met you and I shadowed you, and you were super passionate about what you were doing. And I was like, okay, I'll take a look at this. We'll see what's going on. And then I remember Christine, our practice manager, she actually gave me some homework to actually look at what was functional medicine, what was integrative medicine. As I did my own research, like late at night, I was like, oh, this is actually what I want to do. This is the type of medicine that kind of takes a look at the patient's like kind of like their whole history, their whole body, like everything about them, and then uses that to kind of like tweak their health and actually like give them the best healthcare outcomes, as opposed to just like maybe just shoveling something at them and just being like, okay, just use this one thing, because people are a little more nuanced.
Kind of taking a deeper dive into things, and like you said, I think before really listening to them. And how about you, Akhil?
So for me, it kind of started with kind of my own personal medical issues. I have some thyroid problems, and nothing was really helping me out. It even took a while for a doctor to diagnose me with that. So after that, I did a ton of research into, thyroid health, autoimmune disorders, and this and that. And I noticed how diet and all these other external factors and internal factors outside of just taking medication could, hugely benefit your overall health. And it was so obvious to me. I was like, yeah, of course, eating healthy would make me feel healthier. But I did a deep dive into it. It's like, oh, there's certain foods you should stay away from. There's certain diets you should try out. Meditation's an important thing. Sleep's an important thing. And I knew they're important, but to what extent, I don't think I really understood until I did my own research. And then obviously it brought me like CIH too. Like that was a big reason why I applied here and really wanted to get the job here. So.
And you found that in your personal life to be helpful, all those nutrition, lifestyle pieces with your thyroid and everything?
Yeah, definitely. And I'm glad that I got such great practitioners here too, to like just bounce off ideas like, hey, what do you think about this?
Right.
So yeah, it was definitely incredibly helpful.
Nice. And do you feel that your experience at CIH has shaped how you see your future role as a doctor? And if so, how so?
I'd say definitely yeah, because before I definitely didn't see myself doing integrated medicine. I didn't even know what it was. But the thought of me being a dermatologist and endocrinologist and being able to implement like different aspects of integrative medicine, I think I'd be able to actually treat my patients like fully as I'd like to, or as, I guess, comprehensively as I believe I would wanted to in the first place.
Yes.
Mm-hmm. Yeah, 100% it has. And, I think a lot of it too is coming from shadowing Dr. Wong, shadowing you specifically, right? I've shadowed a ton of physicians before, and I think, because your appointments are a little bit longer, you're able to kind of know the patient, get to know the patient. You ask about their family, what's your social support system? I was like, doctors ask that question? Like, I've never heard that in my life before. And I think those are the type of questions I've always thought that I wish that they asked me as a patient, and I saw you doing it, and I was like, oh, it can be done. So it's just like what Tope was saying, the whole like looking at a patient holistically, figuring out all these different factors aside from what is the specific medical issue that you're here for. And I think that leads to healthier patients. And yeah.
True. And also just like promoting wellness,
yeah,
which is something that I didn't really hear about until I came here, which is funny because like you think like healthcare practitioners would like really promote wellness, but a lot of times we won't really actually do that. We'll just look at baseline. Okay, let's just get you to this point. Whereas with integrative medicine, I've seen that they actually decide to say like, okay, let's see if we can like maximize how you're feeling, your energy levels, your tiredness, like your mood. How can we actually help you get to like 100%?
Yes, and just to add on to what you both said, Dr. Mark Hyman, who's a leading functional medicine doctor, often says that illness and symptoms are caused by certain root causes. And so when we focus on wellness, often a lot of times the symptoms go away as a side effect of optimizing wellness. So this is kind of what integrative health is about. Thank you so much for that insight there. What do you hope to gain from medical school? First of all, congratulations again to both of you. Now that you're kind of on your way, welcome to the club, medical school. What do you hope to gain from medical school? And then one corollary question to that, are there any areas that you may foresee being lacking in medical school that you might need to kind of bone up on the side, things like nutrition and things like that?
Yeah, so obviously for medical school, I want to gain the basic understanding of what is medicine. Understand your biochemical classes, your genetics, all these different things, and just to get that basic understanding, so I can understand and explain things to patients. For example, hey, this is biochemically what's going on in your body, and also just the patient care. The constant patient exposure and understanding. What do I do if a patient's having a heart attack? In theory, I know about that right now, but not actually. Like, I don't know what I would do, but gaining those experiences, and also maybe even researching a little bit. That's something that I got into a couple of years ago, and that's something that I kind of want to continue, specifically studying the gut microbiome. I know you had an episode with Araceli. Like, that's something I'm really interested in. And some of the areas that I think are lacking, I wish there was nutrition classes. I wish there were maybe more classes that would talk about how do you approach different patients from different demographics. I don't fully know it. Hopefully the school that I go to has all of that incorporated in it, but from my understanding of medical education, I think those are kind of some of the areas that are lacking.
Mm-hmm.
Yeah.
The University of Arizona Integrative Medicine program does have some sort of program for medical schools and residencies. It's on their website, I believe, and they're trying to advocate for more nutrition education, lifestyle education, integrative health education in medical schools and residencies. So it is coming. It's sort of slow to change, but it is coming. So thanks for that. And Tope, what about you? What do you hope to gain from medical school?
What I would hope to gain from medical school is definitely just regular, just like conventional Western medical training, looking for a lot of patient contact and just kind of just how to communicate with patients. And what I'd say, what medical school won't really offer me, which I'm looking for, is definitely nutrition, because they don't seem to offer that really at all. And I found that out when I was working here. That was something I thought they did, but I'm realizing now not as much. I'm also definitely interested in learning about like different modalities of medicine, like Chinese medicine, Ayurveda, and also herbalism too.
You'll have to get that after medical school.
I'm
just letting you know right now.
Yeah, the longer I study, I'm like, oh, there's more training.
Which I think
just
Western medicine is a good basis for kind of building on top of that. It's a great foundation. So I think both you'll be well served. Wherever you go, there's every medical school is excellent in their own right. So, and I think we alluded to this before, but do you think that lifestyle nutrition are important for patient outcomes? How have you seen that work? Either here or elsewhere?
No, it's not important. No,
not important at all. Okay, just give them the pill.
Just take your medicine, and then you'll be good. Yeah.
Okay. All right.
Of course. I mean, it's incredibly important. Like you have to, if you're having some sort of recurring like chronic illness, I feel like majority of patients, at least that we deal with, here, they have maybe an autoimmune disorder, diabetes, obesity, something is going on that's chronic that can be kind of managed a little bit. And managing is not just done through taking the medications, it's through your lifestyle. Like, are you getting your 7-8 hours of sleep every night? Are you eating healthy? Are you, like exercising? Are you spending time with your family? Doing things that you want to be doing. And so I think that's incredibly, you can't separate that from just that one health issue that you're having. Like when you address your holistic self, I think that's when you're able to, like weed out those other pressing like diseases that's going on in your body.
Yeah, I agree. And definitely I'll say one thing is doctors definitely give you guidance, but the person who puts in all the work is definitely the patient.
Yep.
So how they handle like their lifestyle with, once again, just like how they handle stress, definitely nutrition, exercise, all that plays the biggest role in the patient outcome.
So you're saying the patient is in charge of their own outcome, correct?
Oh yeah.
They're in charge of their own body. That kind of makes sense to me.
Yeah, because
Yep.
I mean, I guess we can say we. Not yet, but in 4 years,
Yeah.
I'll say we. But
You can say it now. You're
all right.
there.
I guess I'll say it. We, but we will only really get to be with the patient for, let's say, how long? Like here, which is very fortunate for most patients, like an hour a session. So that might turn out to like being 2 hours a year.
Mm-hmm.
And the patient, like, they're dealing with the other, like, how many thousands of hours.
Yeah.
So it's important for them to actually take care of themselves and maximize that time, because that's the time that really, really counts.
Couldn't have said it better myself. Thank you so much. What other factors do you feel are important to patient outcomes? So things like the patient-practitioner relationship, how the rest of the team integrates with medical system, medical modalities such as acupuncture, bodywork, PT, etc.
Well, I think you have to like your doctor or your provider, and your provider has to kind of like you, and that has to work, right? So I think there has to be a baseline of just respect and understanding there. I feel like a lot of times you may not get that with your provider. You're just going to get a checkup. Your doctor doesn't know anything about you, and here, you kind of see, like Dr. Wong knows about people's family, how are your kids doing, like are they playing their football game, all these type of things. I think that allows the patient to open up more and talk about what are the reasons you may not be following a certain protocol that you recommended, because there's all these different issues that may be facing it. And I think that's super important, just that relationship to have and just that open and honest understanding, so a patient can just truly be themselves and just get, advice from a medical expert.
And working in this clinic, how have you seen the integration of different modalities work with medicine, say like nutritionists and acupuncture, bodywork, PT? How have you both kind of witnessed that?
With this clinic, it's really nice because you definitely have everything all together. So when they do see their provider, and then you may know that they're dealing with a certain problem, and then you think that, okay, this modality might be useful for them. The fact that you can kind of just say, oh, can you go see Liz maybe on Wednesdays or something like that, right before your kid's like basketball game. So it's really nice how we can just kind of like have one thing flow to another, as opposed to my experiences just growing up, which is you see a doctor and then they say, okay, you need to go to this other doctor like all the way across town, and then I end up not going, of course. So it's really nice how everything really is integrated into this like integrative practice, as you can so to say.
Yeah.
I think the nutrition's really cool too. Like I've never seen that at a doctor's office before, where they're like, oh yeah, just go see the nutritionist right across the hall. It's like, really? Like there's nutritionists that you can just, and that makes just so much sense to me, to have a nutritionist working at a physician's office or provider's office, because nutrition and lifestyle, that's so inextricably tied to your overall health. And if a patient is struggling with diabetes, obviously a lot of that is with nutrition issues. So go see the nutrition, you can work on that. And therefore, like what Tope was saying earlier, you only see your doctor for maybe 2 hours a year. And with a nutritionist, you can work more hands-on and spend a little bit more time with them, and you're getting like this holistic approach to it. And like Dr. Wong always says, you take a team-based approach to the healthcare plan, and we see that with the nutritionist, with IV nutrition, a whole bunch of different things.
Yeah, it takes a village, and nutrition is a huge part of it, because food is one of the best, if not the most powerful medicine. So we're really lucky to have amazing nutritionists here. Also, just what you had said before is that relationship is really the foundation of healing. And this is really important for all listeners out there, whether you have an integrative doctor, functional doctor, naturopathic doctor, acupuncturist, massage therapist, physical therapist, any kind of Western trained doctor, right? So basically, it doesn't matter if the relationship is not there. The relationship's got to be there with the practitioner, and they have to trust and respect them. They have to ideally know you as a person, not just as a collection of diagnoses.
Yeah.
And that's going to be really powerful and helpful for their healing.
Yeah. And I'll say, especially for this practice, it's amazing how, since everything's all together and the person who you're sending your patient to, on a deep level and you see every day, when it comes to just communicating a patient's needs, when it's a nutritionist's first time seeing a patient, it's kind of not so much, because they already know you and you've already shared so much about them with them, where they're just extra prepared to treat them.
Yeah, the communication, crosstalk back and forth is really great. What do you think an ideal healthcare system would be like, and are there any specific changes you would like to see? The future doctor of the world here, Akhil and Tope.
So I think we should abolish prior authorizations. I think that would be
I agree.
Great. Yeah.
Okay, that might solve 50% of the issues right there, but great.
I think Obviously, there's a lot of problems with the healthcare system. I think we have a decent one. I think it's not great. The one thing that I hate to see is like when a patient is like, "Oh, I can't afford to do this test." You know, I think that you shouldn't have to worry about that. If this is truly going to help you in your healthcare, that you should get whatever test needs to be done, whatever protocol needs to be done, whatever treatment. And I think that is a really big issue that we're constantly facing.
Access.
And it is access
Yeah.
exactly too. And like fortunately, like some clinics will take Medicare, some clinics don't, and there's all these different layers of access too that we have to approach. And it's a tall task. I know there's a lot of people much smarter than me that tried to figure it out that couldn't. So I just hope that we can maybe, as we get older, and me and Tope are like actual physicians, like we can maybe propose a change or work through that.
You could also run for Congress. That's another future plan.
I think I'm okay.
There's a lot of physicians that have run for
Hey,
Congress.
who knows?
Tope, what do you think an ideal healthcare system would be like, and are there any specific changes you'd like to see? Same question for you.
So I'm definitely still learning more about the healthcare system. So I don't know if my answer is going to be as beautiful and nuanced as Akhil's, but I'll say the healthcare system, at least an ideal one, definitely incentivizes, I'd say, more preventative medicine, because I feel like that's something that's not really as looked at least when it comes to, I guess, insurance and all that. I feel like they don't give as much value to it as, let's say, like procedures per se, when preventative medicine is really the thing that's going to help people live longer and more healthful lives.
Kind of move the needle the most. I totally agree.
Mm-hmm.
How do you hope to influence the healthcare system as a future doctor? Say you're looking at 4 years of medical school, probably residency after that, and are there any specific ways of practicing that you would like to work towards? Doesn't necessarily mean a specialty, but kind of how would you like to practice?
So, yeah, a really big thing that I want to do is whatever community that I decide to work in as a physician, I want to make sure that I'm incorporating the needs of that community into my healthcare. For example, if I'm working in a place that has, extremely high rates of chronic disease that are preventable, have patient education classes, like CIH does, we have those weekly seminars and Zoom meetings. I think that's so incredibly important to have, and just so patients can learn, because people want to learn, they just don't know where to look sometimes because there's so much information all over the place. And if they can just go directly to their doctor and be like, "Hey doc, like, what is diabetes exactly? What is obesity exactly? How do I reduce this?" All these different things I think would extremely help out your patient population. And that's kind of what I want to do. And maybe even get involved at a younger age, teach classes in a high school, like, or for high schoolers or middle schoolers, like, every weekend be like, "Hey, you can shadow a doctor and, learn how to suture, or you can, learn how to use a stethoscope," like little things like that I can make a meaningful change in my community. Because I think if you want to actually uplift the health of the whole community, of the country, of the world, you have to start in your little tiny corner first.
Yeah. Big changes start small, right?
Mm-hmm. Yep.
It's great.
So a specific way of practicing I'd like to work towards is definitely just being entrenched in a community and having a huge presence there, just so that I can gain the trust of the community, so that when they come to me, they know that I'm someone they can trust and that can help them. I'm definitely looking to hopefully do something along the lines of what you're doing with this podcast and with what you do with your different classes, where you can just give patients a different avenue to learn more about their health, where they don't necessarily have to come into clinic to see you per se, but they can just access you online and then benefit through that.
Telehealth has been a big game changer for access, and I think, as both of you said, knowledge is empowerment, although too much knowledge is probably confusion, right? Too much information, Dr. Google, etc. So I think kind of separating it out a bit and seeing what's important, and that can be really helpful for people. Great. Well, we have some time for some fun questions here, some closing questions for this podcast. So first of all, do you have a morning routine, and what is it? And of course, knowing both of you, does it include push-ups?
So Tope's morning routine is probably a lot better than mine. I wake up in the morning, I shower, I moisturize, I drink coffee, and I head to work. That's about it.
And what kind of coffee are you drinking in the morning?
So I guess we just got this new mold-free coffee at CIH, which is pretty good. But I just drink regular. I drink the Trader Joe's cold brew with maybe some oat milk, depending on the day. Yeah.
Mm-hmm. I like Trader Joe's.
Yeah.
Tope, what about you?
My morning routine kind of changes every other month, still trying to find a solid one. But right now, I usually wake up kind of early in the morning, do a little reading, and then do a little studying for Spanish because I'm trying to teach myself Spanish. It's a work in progress, but it's moving forward.
Put you on the spot. Any favorite Spanish phrases so far?
Es lo que es. It is what it is.
It is what it is. Okay.
Yeah.
Es lo que es. Thank you. It's a great one. What book or podcast are you enjoying the most right now, and what is it about, and why do you like it?
Well, obviously, the podcast I'm enjoying right now is the CIH podcast.
Obviously.
That's the one that we're listening
There
to. Yeah.
Second favorite, though.
Yeah, my second favorite.
Yeah.
I don't podcasts are something I haven't really gotten into too much. I'm trying to work my way into the whole sphere of it. But the book that I'm reading right now is I'm reading Anthony Bourdain's Kitchen Confidential, which is really cool. You know, I'm really into cooking. I love, you know, like the whole like cooking, chef culture and restaurant culture and all that. So that's something that's been a really cool experience. Mm-hmm.
It's great.
And right now, what am I reading? I'm reading a few things. One of them, I guess, is this Spanish short stories book. It's by Ollie Richards. He's one of these like linguists on YouTube. It's a great book. It has like, of course, short, simple stories that someone who's like beginner to like intermediate level can easily absorb, understand, and learn from. And when it comes to podcasts, one of my favorite right now it's called Bio Bros. It's pretty much this like wellness and like pharmacology podcast where they talk about like bodybuilding. They talk about just overall like longevity, and it's mostly what I'm pretty interested in right now. A lot of because of CIH.
Mm-hmm. Is it like one of the biohacking podcasts, maybe like how to
Yeah.
optimize your physiology and?
Yeah, it's all about like
emotional.
optimizing your physiology and all that.
Nice. What do you do every day to cultivate joy? Really important.
I'd say what I do every day is 100% I practice gratitude, and then working out for me really just like cultivates joy. I just love moving my body. So just being able to do that every day really brings me a sense of happiness.
Yeah.
I think for me, just because like the past couple months with applications and finishing up my master's program, it's just been a sprint, and I haven't really had that much time to rest.
So that has not been joyful.
So that has not. So like I've kind of gotten back into it. Like some parts of it are great, you know, but I've kind of gotten back into the things that I like to do, which honestly, like I like to watch Netflix. Frankly, I like to lay on my couch and I like
Let's
to watch
be real.
Netflix.
Netflix is a
Like
good
I like to do that.
opportunity to
Yeah.
relax.
I like to, you know, I'm the annoying friend who's always FaceTiming you. You know, it's like I'm that guy. So it's like I'm calling my friends on my way back from home and saying, "Hey, how you doing?" This
He
One of the
does
best
call
ways
quite a
to
bit.
Yeah.
cultivate joy.
Exactly. And it's
Yeah,
like, I just
it's
love
great.
being around people. And
Yeah.
it's my mom. Like I call my mom every day, and she's like, "Okay, you're calling me a little too much now. Like I have stuff to do." But but it's, you know, just being around people. And obviously, like Tope is saying, I've like recently got back into working out too. So and listening to music. You know, caught
Yeah.
up with a whole bunch of music I haven't listened to in a while.
Any
so.
favorites? Both of you, music.
Uh,
Now?
Right now, I'm getting back into 50 Cent again. Listen
Yeah,
to a lot of
50
50.
Cent?
Yeah.
Alright.
There's a new Don Toliver album that came out, and then also Snow Allegra, which is a great R&B artist, and you should check her out if you guys are into R&B.
So I'm going to do a little quiz for you guys, and this is not going to be graded or be a prerequisite to medical school admission at all. We kind of talk about here about these 5 lifestyle aspects, smart lifestyle, so sleep, mindset, activity, real food, and ties. I'm just kind of curious, after working here for a while, seeing patients and implementing these smart lifestyles yourself, which of these would be most important to you and why?
Sleep.
Sleep.
Frankly,
okay.
I think sleep is a huge one for me. I normally am a pretty low energy type person in general, so I usually need my 7 to 8 hours, and when I can get the 8 hours of sleep, like I notice like my entire day changes. I'm able to think way more clearly, like completely reduce my brain fog. I get way more things done. I feel motivated. I feel happier. All these different things. So sleep is definitely the one for me.
Yeah, same here. Sleep definitely for me. I know you guys have seen me around the office. When I don't get my sleep, I'm walking around like a zombie.
Yeah.
So sleep is something that I've definitely been trying to like optimize, especially over this last like year of applications, which has been the most stress ever.
Yeah.
So yeah, I think once I finally master my sleep, I'll be where I want to be, which is soon.
Thank you so much, Tope and Akhil, for being on the podcast today. It's been a pleasure, and we look forward to following your amazing journeys, both of you, as you move forward with medical school and beyond. So thank you so much.
Thank you so much, Dr.
Yeah,
Wong.
thanks.
Thanks, CIH.